As we sit here today, millions of adults are suffering with chronic pain. Not only does that make daily tasks a struggle, but it can have a huge emotional impact as well. In this segment, sponsored by Integrated Pain Solutions, together with American Pain Consortium, I'm happy to welcome in Dr. David Walega to share all the ways that they help their patients every day. So good to have you in.
Good morning, Robin. Thanks for inviting me.
You know, I want to talk about you a little bit since
Sure.
This is the first time you're with us on Daytime. Tell us about kind of your history. What led you to Integrated Pain Solutions?
Sure. So I'm a board-certified anesthesiologist with subspecialty training in interventional pain medicine. I have been practicing in Chicago and am a recent transplant to Columbus.
Well, welcome.
Thank you. It's been great so far. So I had actually been practicing in an academic environment, not only seeing, treating, and evaluating patients, but also teaching residents and fellows for the past 20 years. And I've actually trained over 100 specialists, such as myself, to do the things that I do. Recently moved to Columbus to join this particular practice, which is a phenomenal group of physicians. We actually have 3 locations here in Ohio, one in Springfield, one in Dublin, and my office in Columbus in the Polaris area. And it's been a great start so far.
Yeah, so I want to ask that a little deeper. What is your why? Why did you get into this field in particular?
Yeah, well, I went to medical school because I wanted to be a physician that took care of patients.
Sure.
And during my anesthesia training, and again, this is in the 90s, when pain was still in its infancy as a subspecialty. I did my 1-month rotation and just thought that this was the most amazing subspecialty you could imagine. You really get to know your patients one-on-one. You identify specific problems that they are having with their pain, with their function. You learn about their families. You learn or help them learn about what their goals for treatment are. And then you actually have an intervention, usually, that almost immediately or in the course of treatments takes their pain away and restores their function. So to me, there's nothing more satisfying as a physician.
Right, that end result of seeing that you set out what you wanted to do, right? You helped that patient. So let's talk about treatments then and how you are able to help that patient. Because I know a lot of times, and in your specialty, you work on non-surgical approaches first, right? Is that always kind of the starting point with your patients?
I think a good rule in interventional pain medicine is to start with the least invasive thing first. So there are some patients with subacute or relatively recent pain problems that will respond to simple things like physical therapy, a short course of a medication of some sort. But there are other patients that don't get better with those interventions and do require some sort of therapeutic or diagnostic nerve block, joint injection, ablation procedure, et cetera, to reduce their pain more long term. And our overall goal here with all of these treatments and interventions is to restore function and get people back to a more normal existence where they can take care of their children, go to church or synagogue, be involved in their community, go to work, and not be exhausted by carrying the burden of pain all day, every day.
And that really is, I would say, probably the synopsis of what pain management is, right? Is to getting your patients back to being able to do what they love, because nobody wants to have a life where they can't do all of those things.
Correct. Restoration of function is really what we're going for.
Is your goal. Okay, and I will say, what is it like, doctor, when you first meet with that patient, when you're taking in all that information, you're trying to figure it out? Because I'm sure that you have patients that come to you with a bit of frustration, right, and anxiety, that they have tried it all, right, and they don't know what's going to work for them.
What I have discovered is most patients that end up in my office have already seen 2 or more specialists, and they either didn't feel heard or the provider that they saw didn't really have any tools in their toolbox that would be effective for them.
Okay.
So we first start having a conversation. What is the problem? How long has it been there? What are your expectations of me? We need to appropriately set expectations. If you've had pain for 20 years and you've had 12 surgeries and you're already on a laundry list of medications, very unlikely we're going to be able to fix that today or next week.
Sure.
We're going to have a longer relationship. But the goal setting is really the most important thing, and the goal is going to be different for each patient. Some people want to return to work. Other people simply want to be able to go and walk their dog.
Yeah.
So an individualized approach to that initial assessment is really critical.
Doctor, I want you to leave us today with how then someone can reach out to your team if they want to start this conversation and they want to look into all the avenues you can help them with.
Sure.
How do they do that?
Well, I believe we have a QR code
We
that
do. It
has
is on the
our
screen.
practice information. They can reach out to Integrated Pain Solutions, and we can set up a consultation in the office.
And have that conversation, get things started, and be heard.
Absolutely.
If that's what you haven't felt over the last decade or so, because I know a lot of people struggle for a long time. So.
Absolutely.
All right. It is Integrated Pain Solutions. Doctor, thank you.
Thanks so much, Robin.